Hello and welcome. I'm Dr. Keith Lynch. I've been in private practice here in Central Virginia in Charlottesville since 1998. And I've been board certified in Atlas Orthogonal Chiropractic since 2000. What we're going to talk about is our structural adjusting program for the Atlas area. Now the Atlas, or C1 as it's known, sits right underneath the skull. It's the very top vertebra of the spine. And that Atlas vertebra weighs about 1 to 2 ounces, and your head or skull above that bone weighs 10 to 12 ounces. In health, that bone sits right around and protects your brain stem, and it also has the vertebral artery, which brings blood supply up from the heart up into the skull through to the brain stem as well as to the cortex. So it's a very important area. When we make our adjustments to that area, we use a specific instrument that makes an adjustment force of about 1.8 pounds. So it's very delicate. And the reason is because this. When that head gets off-centered over the neck, it can put pressure on that atlas and blood vessel area. We call that neurovascular compression. Neurovascular compression means this. It means that the blood vessels can be compromised, reducing the amount of blood flow to the brain stem, which controls digestion, absorption, elimination. It controls our eye function and all the sensory organs inside the head, as well as cognition up into the cortex. So people who have migraine headaches, people who have epilepsy disorders, people with head, neck, and shoulder problems, jaw and facial pain, this area is often implicated as one of the sources causing those problems. So when we have neurovascular compression, it's going to put pressure on the blood vessels going through that area. It can also put direct pressure on the brainstem itself, and then it can also cause the muscles underneath the skull here to be extremely tight, reducing your range of motion and causing further problems both up and down the spine from that area. When the atlas misaligns underneath the skull, what happens is there's a righting reflex in the body that's always going to keep your eyes level with the horizon. So if that vertebra comes up on your left side like this, it's very uncommon to see somebody walking around like this. What you're going to see is a postural distortion where the spine is going to bend or curve, and the eyes are going to become level with the horizon. So what you see is less of the head tilt, and you're going to see more of a postural distortion that gets displayed throughout the entire rest of the body. So one shoulder may become higher than the other, one hip may draw up higher than the other, and it can cause a curvature through the spinal column, allowing that head to be level over the center of the body. So not only can it cause problems or symptoms up in the head and face area, but it's going to cause problems from the neck area down throughout the pelvis, because it's going to cause certain muscles to become over-tightened while other muscles have to relax to allow that spine to curve. That's what we call a postural distortion, and that's one of the things that we're checking for when you have an atlas misalignment. Now, the way that we correct this misalignment is through specific x-rays and analysis of that head and neck area. So after a thorough examination is done on that head, neck, and spinal area, we take 3 specific x-rays to show us the front, the side, and the top, so that we have a 3-dimensional image of that misalignment. After measuring that, we get what we call factors or vectors. It becomes a force direction that we use with our instrument to make the correction. Let's go ahead and take a look at that right now. This is the Atlas Orthogonal Adjusting Instrument. Most people, when they first see this instrument, they think it looks pretty scary and they go, boy, my neck already hurts, you're not going to touch me with that thing. However, what they find out is the way this instrument works is there's a 1.8 pound solenoid, or a very small electric hammer, which comes down inside of this here. And it strikes the top of this metal piece called the stylus. Now this stylus here, as you'll see, does not go up and down. So if you were to put your finger under it and feel that, you'd probably say what most of my patients say and say, I don't feel hardly anything. And that's good because it's designed so that you don't feel it. Imagine if you've just been in trauma or in a car accident and you can't move your head and neck around. This instrument's designed so that we can lay you on your side on this table, precisely align you, put the appropriate factors based on your x-rays into the instrument, and then what we do is we deliver that 1.8 pounds of force to that atlas bone or that top vertebra in your neck. And what's going to happen is that top bone in the neck is going to slide right underneath the skull, just like this. So even though you hardly feel anything, that vertebra is going to slide back to its normal position due to a precision amount of force, just 1.8 pounds, right over that atlas or top of the neck region. By doing that, it immediately takes pressure off that brainstem area. It allows the blood vessels to start delivering the right amount of oxygen and nutrients up to the brain. It allows the spinal column itself to start leveling out, takes pressure off the muscles that were holding you in a postural distortion to begin with, and the self-healing process begins. That's how the Atlas Orthogonal adjustment works, and it's a very effective and efficient tool in helping people get their lives back and get out of pain.